in the heart of Birmingham, at one of the UK's leading digital innovation gatherings, Digital Health Rewired, something powerful happened. Not just conversations, not just technology, but a quiet transformation of healthcare itself. For decades, nursing and healthcare practice have been defined by the bedside, hands-on care, human connection, and clinical expertise. But today, a new frontier is emerging. A space where care meets code, where compassion meets computation, where healthcare professionals are no longer just users of systems, but shapers of the future. Welcome to the world of digital health.
Right, so this is 2026 and I'm right now in NEC Auditorium in Birmingham for a Rewired conference, and this promises to be the best conference of its kind ever been held in the digital sphere. There are wonderful speakers from all over the UK coming, and having attended it for some time, I think it's proven to be one of the most inspiring that you can come across in terms of digital health. So very excited about what it's got to offer.
Digital health is not just a buzzword. It is a rapidly growing global sector projected to reach over $900 billion by 2030. From electronic prescribing systems to infection surveillance dashboards to AI-powered diagnostics, these innovations are already transforming how care is delivered, monitored, and improved. And yet, there is a critical gap. A gap between those who design these systems and those who use them every single day.
I'm Jules Opokunkroma and Aaron, and a mom who is creating content on digital nursing, digital health, transitioning into digital processes and all that. So I'm here at Rewired to get a hold on things, to meet people, to network, because that is it. You can't be looking for opportunities when you are not networking. So that's the reason why I'm here. And it's also to encourage I'm an international nurse, other international nurses, that opportunities are out here. If we get to look for it, I think we can find it.
On a face value, nurses and healthcare workers generate the highest healthcare data. But how many are involved in shaping the tools that capture it? How many understand the algorithms behind the alerts they respond to? How many are influencing the digital systems that now define patient safety?
Well, I think my two pieces for nurses is to look beyond the bedside. In as much as I value clinical practice as well, I know they make massive contribution to patient care. They're the backbone of healthcare. But I think nursing has transitioned beyond the bedside nursing and now looking at how we move care from hospital to the community and how we can reach out to patients within the comfort of their zone. So this is a time for nurses to look at how they can transform the healthcare through digital. Obviously, there are a lot, and as healthcare professionals who have that system background knowledge, it's an opportunity for them to bring their knowledge into shaping how the digital landscape is going to work within the next 5 to 10 years. Obviously, we as clinicians work within the hospital. We understand what our patient need. We understand what the clinical pressure is. So it's time for nurses to translate that into an actionable insight and help the technical team to build a solution that works for patient and the staff.
At the Digital Health Rewired, innovators showcase solutions designed to solve real clinical problems, reducing medication errors through electronic prescribing, tracking infections in real time, using AI to predict patient deterioration, streamlining workflows to reduce burnout.
We work for a company called IOTO. We do eye examinations with remote slit lens. We sell slit lens devices to optometrists who will examine eyes. What we do is we specialize in it can be a remote control. So an IED, the optometrist doesn't need to be on site, or it can be done by in-house clinician who's not necessarily an optician but can take all the videos and images and send them off to the optometrist who's not necessarily inside. So it's hopefully just a streamline taking slit lens exams on eyes.
And we've got to be cognizant of that fact as more of our systems are digitised. The days of having just paper around are disappearing, although you could argue that a PDF version of the paper is as useful as the paper copy, but we love digitising things. So I'm going to touch on interweave.
We feel really passionate about this idea of creating a community around automation, not just for the skill set growth, but also the shareability of NHS IP. Everyone is doing the same in a similar way, and there's a really great opportunity, I think, to come together as a collective to ease that. So that's a cool point.
It's in that ecosystem, and everything plays. If you see happy patients as a clinician, you're probably going to be a happy clinician yourself.
Who thought you'd get well-being at the early morning AI session, right? But that's what we're getting. So we've got 3 minutes, guys. Let's have final closing comments. Karen, how's it been for you? How's the panel? What do you want to tell them about visiting the stand? What are the things you're really excited about?
Yeah, as I said on my slide, we're on slide stand F43. Come and talk to us about any use cases where we can drive clinical admin savings
and see the inspiration so they don't reinvent the wheel, right?
Absolutely. We've got the technology, we just need to work with you to deliver those outcomes.
And 2,700 engineers, 2,700 staff?
7,000.
I'm so sorry.
Worldwide, but...
Yes. And these are both, we're talking hundreds of billion-dollar industries here on this panel. You know, please make use of these connections, right? Critical. Indra?
I mean, at the end of the day, this has been a really fascinating story, and I quite like it. My one takeaway that I reflect on, and this is a personal thing, I think we are slightly in danger of getting quite excited about AI and what it can do in agents. And it always reflects back to those weeks that I remember in A&E when you end up in resus back to back. And if you end up in resus back to back, you burn out very, very quickly. We all want minors. We all love a broken finger. So let's just be careful. I like your failure demand.
Yeah.
What was it? I can't even remember
I think it's failure demand, but demand failure sounds better, I think, right? Yeah.
Let's just keep that in mind when we're designing systems.
Yeah.
And just remember, at the end of the day, our job as technologists is to make this easier for you, to make it smoother for you.
Studies show that electronic prescribing systems alone can reduce medication errors by a high percentage, but technology is only as effective as the people who design, implement, and use it. This is where healthcare workers, especially nurses, must step in. Because digital health is not just for IT specialists. It is for the nurse who notices inefficiencies in documentation, the infection control practitioner tracking outbreaks, the clinician frustrated by poor system design, the healthcare worker who wants to improve patient safety at scale.
Right.
Yeah, nice to meet you here.
Yeah, same here.
Nice. I understand you do EPR implementation and you
EPMA actually.
EPMA.
Yeah.
And I was wondering what benefits there are for nurses who are into that role, and then how this system impacts, or the use of this system impacts patient care.
So the first question is, how can nurses get involved, right? And how does that impact on patient care? Let me just start from the beginning. But thank you very much for having me on your show. If I can use that word. There's a lot of conversation about if digital nursing. I don't use that word very often because I don't think there's any digital nursing. There's nothing like that. But there's a lot of conversation around if digital nursing is different from nursing as it were. But my argument to that is it's not something that is separated from what we do.
Yeah.
I'll give you an example. Yeah, I was born in an era where I experienced not a phase where there was no mobile phone, right?
Yeah.
When my mom traveled or my parents traveled, any of them, we just assume they are gone and they will come back when they say they were back. Yeah, that's the plan.
right? But I also live in an era where now on my phone, I can talk to my delivery driver or my mailman.
Yeah.
Just using a dash camera, I can do that. So there's a lot of changes that has happened. I don't see myself as a digital human, right?
Yeah.
I just followed the new trend. I got a phone. Then people say, "Oh, iPhone is better." I got an iPhone. I got a proper laptop, a better laptop. We just flowed along with the changes.
Yeah.
Now I can text my mom now, and she can be in Canada, and then she will still reply.
Respond,
So she will still respond. So a lot of things have really changed.
Yeah.
We just moved along with that change. So that's the reason why I don't see digital nursing as something different from nursing. It's like a platform. It's like a platform on which the service we deliver to our patient. We want to improve the service we deliver to our patients. And from what history has showed us, digital seems to, it's the way forward, and we're just building on that. So I don't think, nurses ask me, how do I get involved? And I said to them, every nurse is a digital nurse, if we're going to use that phrase, because when you walk on into your ward, the first thing you do, you tap in your card, your ID card to let you through those security doors. You go onto your the nursing station, you put in your NHS card, you log on. You're using a system, so we are all digital nurses. So if for any reason anybody wants to step into that space, and I think most of these digital related roles are created because of funding, and because you need people who are free from the front line, so to say, to do that work and focus on it. That's why these separate roles are created. It doesn't mean that digital nursing is different. It's a separate entity out of the frontline care. It's the same, and it's just having pilots and co-pilots who are just looking after that, just to make sure we're all on the same page. So how can nurses get involved? We're involved in it already. We don't need to have digital in our title to feel that we are working in that space. We're doing it already. But for those who are passionate about getting to that space, I would just say, don't limit yourself, don't restrict yourself, go for it. When people send me a message on LinkedIn or send me a message on WhatsApp, I just say, if you see the job, look at the job description and you think, oh, that is interesting, put yourself forward, apply for it, you never know. And how can this affect, to your next question about the services to our patient? I think that is the 10-year plan, 10-year NHS plan is looking at acute from hospital to community. We're looking at analog to digital, and we're looking at what's the third one now? You just remind me, I've forgotten. But everything we're looking at, on that 10-year NHS plan, the foundation is having a very strong digital base to deliver that. We can deliver that more efficiently using the digital platforms we have. So it's a way forward. It's here and it's here to stay. We're not going back.
And I'm guessing that this would also help us improve patient care and monitor patients' welfare in real time.
For example, look at the NHS app. There's a lot of conversation, a lot of work that's going on in the background around how the NHS app can be used intuitively and can be used to make, for example, the last time I went to my GP, the last time I booked an appointment with my GP, I booked an appointment on my NHS app. A couple of years before, I couldn't do that. And now, even with medicine management, you can order your medication. Some GP surgeries can do that now. You can do your repeat prescriptions. I think so. Now on some of the apps, what you do, and now you can track it. You can even track, if you're pharmacy, you can track your request if it has gone through, and all of that improvement is hoping that I don't have to go and queue in an outpatient, or if it's not absolutely necessary, if it's something I can do from home. So all of those initiatives, it's coming, and it's here to stay.
So it's just good for the nurses to consider just getting into those
Yeah.
sectors because it has come to stay.
Absolutely, and I think it's just changing our mindsets. Yeah, I think there's a lot of work we need to do about the way we think about it.
Yeah.
If we think about it as a tool, yeah, if you think about it that okay, I want to deliver the best service to my patients, and this is the tool that I have, is to engage with it.
Yeah.
Some of the tools are not the best, all right? We have different EPR system vendors, we have different EPMA systems, vendor providers. Some of them are not the best, but our responsibility is to look at what we've been provided and say, okay, I have this product in front of me. How does it work?
Yeah.
How can it be better? And how can it help the service I provide to my patients better, and feed that back to know in your trust, know where the information can go, right?
Yeah.
If you have a excuse me, have an issue you want to feed back to say, okay, I don't think this process is working, but this idea I have on how to make it work. You need to know what channel to take that through in your trust, and be that person to say, and be that person to make things work and not just complain about it. Because if we complain about it, it's not going to change anything. The contracts that we have with this EPR and EPMA, some contracts are for 5 years, are for 3 years. So it's not like going to the market or going to the supermarket and buying a top, and then after 2 days, you're like, oh, you discover that the button is fall off, and then you return it. With this EPR system, some of them is 3 years and 5 years and 4 years. So we can't keep hoping that, oh, we have a new one next year, or we have another one in 2 years' time. We need to work with what we have and support your managers and support your IT teams, your transformation team on how to make what you have better. Our feedback is really important because we use it every day. We are the best person to feed back to them to say, I've used it. This is what I think we can do better, and just feed back to them. So that's a job.
Wow. Wow. That's impressive. And my final question has to do with some of the steps that nurses can take, because there are a lot of people who don't know the pathway to becoming digital nurses. So can you give us some practical steps we should take as nurses who are interested in that?
I think the first thing is being very curious. The first thing is ask why and why and why. Okay, so when you have the first why, ask the second why again, and after that ask the third why. I think curiosity is something that we cannot we need to keep building on. I said earlier on that we are all digital nurses in what we do, but if people think, right, I really want to get into this space, I want to be involved in it, I think the first thing is to ask yourself, what is going on in my organization right now? Okay? Find out within your trust, where are we in our digital maturity? Are we still using paper for our electronic record, or do we have a new system we're hoping to get? Where are we? What is the priority in your trust? Hopefully, your trust will have a strategic aim that they're working on around digital. You need to know what your trust is doing in digital in your trust, and just align yourself towards it. And volunteer. Be the digital champion in your ward, right? Be the APMA champion. Be the EPR champion, right? Be that person that people go to say, oh, can you show me how to do this? And obviously, I would imagine you would have had your own training too. So be that link. We have infection control link on the ward. We have teacher viability link nurse on the ward. Why don't we have digital nurse link on the ward? So be that person.
That's something to think
Don't
about.
wait for when a big role is created in your trust. Create something by being proactive and being one that people go to for support, and from there things can just pan out. Your manager sees how enthusiastic, how helpful you've been. If an opportunity comes up, you'll be the first person they will call because you've shown yourself valuable and useful in that space. So I think that's the first place to start. It's just being curious and knowing what is going on in your trust as well as what's going on outside your trust, because we can be easily just confined in this is what is going on in my trust. Do you know what's going on in other trusts as well?
You don't know.
Yeah, so you need to find out. You need to find out and just, yeah, I think that's the best way to start.
Nice.
Yeah.
Thank you very much.
No
It's been
problem.
nice talking to you.
Yeah, same
and,
here. Yeah.
Another day.
Thank you.
Thank you. Imagine this. Instead of documenting care, you designed a system that makes documentation faster. Instead of reacting to infections, you build tools that predict and prevent outbreaks. Instead of working around broken systems, you fix them. Artificial intelligence alone is expected to save the NHS billions annually while improving outcomes. From predictive analytics to virtual wards to remote monitoring, the question is no longer if digital health will transform care. The question is, will you be part of it? Attending Digital Health Rewired reveals something deeper. Behind every innovation is a problem someone chose to solve. And the people best positioned to solve healthcare problems are those who experience them daily. You and I. The future nurse is not only clinically skilled, but digitally empowered. A professional who understands data, systems, innovation, and patient care. This is not about leaving the bedside. It is about expanding your impact beyond it. Healthcare is changing, and the most powerful voice in that change should be the one that understands patients best. So whether you are a nurse, a doctor, a pharmacist, or a healthcare assistant, digital health is not just an option. It is a niche, a pathway, a movement, and it needs you.
Coming here today, I would say has been very insightful. Yeah, before now, I used to think digital health was really a lot more complicated. It seemed like, to me, I needed to be very much ingrained with the tech skills. So I think that made it to be overwhelming. I had to go back to basics to try to upskill, the Excel things and everything. But the more I do it, the more it seems I'm more further away from getting into the real digital health. So I spoke with my colleague. We just got talking, and then he said to me that, oh no, you don't actually need to be the one bringing into light this technology. You just need to work with people who are already tech service, the tech companies, and they need your knowledge as a frontliner, the end users, to be able to implement this thing. So I was like, okay, that's really interesting, and I signed up for this, and coming here today just broke everything down. So now I understand what digital health is more about, and I'm gonna go back, start from the basis, take those introductory courses, and just see where it goes from here, to see what roles or what opportunities that I can make use of. Yeah.
My name is, okay. So for first timers, I think I've discovered, because I came first time 2024, and at that time it was a bit overwhelming because I came alone, and finding where to go, what to do initially was a bit overwhelming. But today I've enjoyed every bit of it because I've understood how it works and what to look out for, and I was better planned. And so yeah, I think overall I've enjoyed myself really, with my lots of goodies as well. That's part of the experience, huh? Thank you.
My biggest takeaway would be that the career path for everybody is not straightforward, and it's not just a roadmap, it's a mind map. So it means that I know my career path where I want to get to, I have the big picture of where I'm going to get to, but I have to plan around it and find different ways that I can get there. So I'm not stuck in thinking there's only one pathway that leads me to where I need to go to. So I would be going home now and I'm sitting down and I'm putting the big picture in the middle of what I want, what my end goal is career-wise, and then I'll think about 3 other career pathways or 3 other ways I'm going to be able to get to that particular place that I want to get to, which means that I'm not at any point in time being dormant, just sitting down in one place and waiting for one particular thing to work out. I'll just have to put my eggs in different baskets and know that at the end of the day, all of those baskets are going to lead me to where I really want to be. So yeah, that's my take.
So I learned about different systems for dispensing of medication that could help medication to be dispensed in a safer way, and it would be easier for the nurses. The nurses don't have to go around the wards searching cupboards and cabinets just to get the medication. I learned about ambient voice technology. I learned about how nurses can help to be more involved in the digital workforce, and while they are making decisions that affect nurses in a way whereby it affects them in like products that are being used digitally or technologies that are being used digitally. Nurses can be more involved, and also not just to stay back and just avoid it, but nurses can be more involved, because those technology can also affect nurses. So if we're not involved in those decisions that are being made, if we're not active, we'll be the ones that will be suffering the end result.
All right, so we have come to the end of the conference, Rewired 2026. And one of the remarkable things about what we did this year is that there's such rich content, especially in the place of NHS digital leadership, and then also in the place of patient engagement. Obviously, AI is the trending thing in healthcare right now, but then an emphasis is given on it, but it appears not to be overemphasized, because people are coming to know more about, it's not all about AI, it's also about digital leadership, digital education, and then other aspects of implementation as well. So I think it's a big eye-opener for me as a person. I spend most of my time in the place of EPR implementation and optimization, because obviously one place of problem for the NHS have been along the lines of optimization and things like that, because lots of trusts across the country are in the place of EPR launching at this stage. So I think it's quite an impactful one. A very resounding gratitude to the people that put this program together. I think it is a must-be place for NHS workers, all over the country. Obviously, it was attended by pharmacists, doctors, nurses, CEOs, CCIOs, CSOs, CEOs of different companies, and then different product developers, as you can see, all over this whole place. So I think it's a wonderful one. And then hopefully next year we are going to see what it's going to evolve into. And I definitely hope to be, here next year, and possibly even take a stage and present more than anything else. But then, that's brilliant.
Don't just adapt to the future of healthcare, help design it. Explore digital health, attend conferences, learn new skills, ask questions, and get involved. Because the next breakthrough in healthcare might come from you.